Kia ora, I'm Dwan and this is the Risk Management Plan for the Ngāti Hine Health Trust. The Ngāti Hine Health Trust is a large Māori health non-government organisation. It delivers an extensive range of health, social, education, housing, justice, radio and child and youth services in the Northern region with a service area that stretches between Kaitaia and Te Hana. It has two main offices located in Kaukaua and Whangarei, 3 satellite centres in Kaikohe and Kaiō, and 4 residential homes. It also has medical and ECE centres based in Kaukaua. The Trust holds 60 service contracts which are funded by a cross-section of government agencies that includes community nursing, alcohol and drug, residential services, disability and home support services, just to name a few. The Trust has a workforce of 350 staff and an annual turnover of approximately 19 million. Identify potential risks. The 4 risks I think may have an impact on the Ngāti Hine Health Trust are a combination of internal and external factors. 1. An emerging infectious disease or pandemic. 2. Changes to workplace health and safety regulations. 3. Service contract compliance. And 4. Management of information and technology. Risk 1. An emerging infectious disease or pandemic. This is an actual risk due to the continued impact COVID-19 has had on New Zealand and the rest of the world. Taking this into consideration, likelihood of risk is high, impact is high, manageability is medium. The risk cannot be eliminated, however, the Trust can minimise the impact of the risk as much as possible. Strategies that the Trust could use to minimise risk: involvement in community reference groups such as civil defence, GP clinics or St John's, involvement in regional and national planning reference groups, the development of a pandemic preparedness plan which aligns with the government strategy to include infection control, redeployment of staff, and confirmation of suppliers of personal protective equipment or PPE and vaccinations. Monitoring and review. The review should occur frequently, every quarter, to be responsive to the ever-changing environment. Risk 2. Changes to workplace health and safety regulations. Changes to law and regulations do not happen often, so the likelihood of risk is low to medium. The impact of risk is medium. Manageability of this risk is high, as changes that do occur are usually communicated well prior to taking effect, so the Trust has an opportunity to make necessary changes so that it remains responsive to the change. Mitigation strategies. The development of a health and safety strategic plan, accident incident management plan, work safety, health and safety committee representatives, and training and induction of all staff. Now, the monitoring and review of this plan should be regular, monthly for WSHS representative meetings, and any findings at those meetings should be reported on quarterly. Risk 3. Service contract compliance, which is an internal factor. The Trust needs to ensure consistency of contractual reporting requirements is maintained. The likelihood of risk is medium. Impact is medium. Manageability of this risk is high. Mitigation strategies the Trust could employ. Development of governance policies and procedures. Management and monitoring of Ngāti Hine Health Trust contracts register. The back office support to provide contracts management, service orientation of new staff, clarity of reporting procedures and requirements, internal control checks, for example, 15-file audit. Monitoring and review, annual reviews for governance policies and procedures, 6-monthly review for internal audits process, monthly monitoring for board report and service contract reporting. Service orientation, staffing and back office support would be as required. Risk 4. Information management, IT, which is an internal factor. The Trust needs to ensure accurate data capture is possible so that it is able to monitor the performance of its staff and analyse data so that funder reporting is completed effectively. Likelihood of risk is medium, impact of risk is medium, and manageability of risk is medium. Mitigation strategies that the Trust could implement to minimise risk is the implementation of an IT management plan, best practice training for client management systems or CMS, super user training, timely IT help desk and support, contractual requirements for data capture and reporting. So in terms of monitoring and review, the governance policies and procedures should be monitored annually. 6-monthly review for all staff, a refresher on training, monthly monitoring to manage staff compliance and reporting, service orientation, staffing induction, and help desk support would be on an as-needed basis. In conclusion, this assessment examines how the pestle analysis tool can support managers to recognise external factors that have a degree of impact on their business. They are able to set mitigation strategies or controls to manage the risk, which is monitored through a risk management plan. The plan needs to be reviewed regularly to ensure optimum effectiveness of the plan. For a comprehensive overview of business risk, however, a SWOT analysis would also be beneficial for looking at the internal risk factors on the business.